Welcome once again. We start the second hour going live to the Eastern Cape. The Premier of the province, Oscar Mabuyane, is announcing a community-based strategy to fight the spread of the coronavirus outbreak in the province. Let's go there live.
Good morning to all the media. The House is present. And good morning, MECs, MEC Health and MEC Education, and the HODs. And good morning to all those who are listening to our weekly press briefing on the update, COVID-19 update. Today marks the 103rd day since we began the national lockdown, as announced by our President Cyril Ramaphosa. In essence, we have been in the battlefield against the coronavirus 2019 for over 3 months now. During this time, we have 38,081 people who have been infected by the virus in our province, and we have seen how vicious this virus is. It has inflicted 528 casualties in our province to date. Our thoughts and prayers are with the families of the departed as they painfully adjust to life without their loved ones. Siyafuna ukutsho okokuba namhlanje sinabantu abayi-38,000 abosulelwe yile ntsholongwane, abantu abangama-528 balandulele eli ngenxa yokunikezela kule ntsholongwane. Sifuna udlulisa amazwi ovelwano kumakhaya onke azibona enyembezana esentlungwini ngenxa yokushiywa ngabo babathandayo. I want to take this opportunity, ladies and gentlemen, to convey our heartfelt condolences to Premier Job Mokgolo and the people of Northwest on their loss of the MEC for Cooperative Governance, Human Settlement and Traditional Affairs. Iyasibonakalisa into kokuba le ntsholongwane ize kakubi kwaye apho ihlaba khona ihlaba ihlasela. The death of our people is the most painful reality that we wished would have not happened, but the virus is hitting us hard now, and it is hitting in our families where it hurts most. It is relentlessly taking the lives of parents, colleagues, friends, wives, husbands, children, relatives, and elders of our communities at the rate that requires adjustment of plans to stop the loss of lives. Definitely, we do not want the number of casualties to rise into thousands as we have seen in other parts of the world. That is why we requested President of our country to come on board and reinforce our effort to fight the COVID-19 by helping us with the South African National Defence Force Military Health Services. Isicelo sethu ke sivakele kumongameli afikile ngenene amajoni asuka kwicandelo lezempilo nogqirha amanesi azosincedisa kule mfazwe siyiqhubayo yokulwa nalo bhubhane simbonayo. La majoni azawusasazwa apha eprovinsini kuzo zonke indawo apho sifuna khona uncedo nokuqiniswa kwemikhosi yethu esebenzayo yogqirha namanesi, ingakumbi phaya eBhayi nalapha eMonti naseMthatha naseKomani, kuba zizona ndawo zitshатsheleyo ngamanani aphezulu okusulelana nabantu namanani aphezulu abantu abaswelekayo. We believe with their arrival we will see a surge in the number of people who are recovering from the virus, as currently they stood at 22,000 as of yesterday. Sizama ukuthi ke ubukho babo buzawuqinisa ngakumbi kulo msebenzi siwenzayo kuba sesiwabonile amanani abantu abakwazi ukulwana le ntsholongwane ngempumelelo uba ayakhula ayancumisa kwaye ngumsebenzi omhle omkhulu owenziwayo nomsebenzi esiwunikela kwabo basebenzayo banjengamanesi nogqirha. Amawaka angama-22 abantu sele bekwazile ukuyoyisa le ntsholongwane. Iyacacisa ke into kokuba le ntsholongwane ayisosigwebo sentambo. Xa uthe wayifumana indlela oye uziphathe ngayo nendlela oye uyihloniphe ngayo le ntsholongwane iya kunceda ukuqinisekisa uba uyakwazi ukulwa nayo ngokwempumelelo. Siku-56% recovery rate kwabo bachaphazelekileyo. Ithetha ukuthi inani labantu abakwazi ukuyoyisa le ntsholongwane likhulu kwinenani labantu ngoku abane le ntsholongwane actively as we speak. The past 112 days of our battle against COVID-19 have given us insights on the kind of the enemy we are facing. We now understand better the modus operandi of COVID-19 than we did 3 months ago when we entered the battlefield with it. There is a vast improvement in the availability and the flow of day-to-day epidemiological data between the various health bodies that are leading the fight against COVID-19, which is crucial for effective planning and response to the virus. We have seen improvement in the provision of personal protective equipment, particularly to frontline health workers. We are also seeing a quick turnaround times on the release of results by our laboratories, with the 51% received within 72 hours. Kodwa umsebenzi usemkhulu kuba the more siba ne-outbreaks, the more i-laboratories zethu ziba phansi koxinezelelo. Contact tracing has also improved drastically. Critically though, the epidemiological data is also enlightening us about worrying developments in our fight against COVID-19, which we feel our people need to hear. Firstly, the reality is that the virus is deadly. Le ntsholongwane inobungozi. Ayinalusini apho ithe yahlasela khona ishiya kucaca into kokuba ibikhe yafika. Ingakumbi kwabo bantu bakuthi banezigulo abanazo. Sizama ke kananjalo ukubongoza abantu bakuthi bayijonge loo nto. Ingakumbi abo banezigulo zeswekile, izigulo ze-hypertension, izigulo ze-HIV and AIDS, abagula ngezifuba nenhliziyo njalo njalo. Siyibonile into kokuba yawufika kubantu abanjalo isibeka engxakini. Izizigulo ke ezilapha kweliphondo lethu. Abantu abaninzi kweliphondo lethu njengoko sasitshilo nangaphambili banomgcineni babo abahamba nabo ingakumbi kwezi zigulo. Yiyo lento kwamhlamnene siye sibongoza abantu kokuba abantu mabazigcine ezindlini. Abantu mabangayi kwindawo ezinabantu abaninzi. Imingcwabo mayihlonitshwe, mayiyekelwe kwii-families. Masiyeke ukungcwaba, masifihle khona ukuze yonke lento siyenze ngenjongo zokunika imbeko nenhlonipho kule ntsholongwane kwabo basashiyeke ngasemva. Siyayibethelela ke lento ithi nina nisindileyo ekreleni hlalani ezindlini zenu. Asifuna ukuthi nina nisindele ekreleni hambani ningemi kuba eke nenza loo nto nawugqiba yonke indawo. Nina nisindileyo ekreleni hlalani ezindlini zenu. Kuba senze loo nto le ntsholongwane siyenza ibhadule ingabinandawo yokuhlala nendawo yokuncathama. Siyababongoza abantu bakuthi kakhulu kuba siyayazi ba apha sinoomakhulu nootamkhulu abahlala nabazukulwana ezindlini emakhayeni, abazali babantwana besemisebenzini kwiindawo ngendawo. Yawukufunyanwa noba ngumntana ifike kumakhulu ayilibazisi le ntsholongwane. Siyayicela ke loo nto, siyibongoza uba abantu bakuthi mabasebenzisane nathi bakhulele uxanduva lokulwa nale ntsholongwane. Secondly, the number of hotspots continue to increase since the relaxation of lockdown to level 3, and transmissions in local municipalities have rapidly increased. Thirdly, we have observed that in the 2 metro municipalities there was a drastic increase of COVID-19 along urban corridors in all directions, with a prominent potential of superclusters and exponential expansion into rural areas with high vulnerability. This requires us to improve our response to the virus. Thus, today we are changing tactics to manage the virus by introducing community-based COVID-19 response plan. This plan is based in the spirit of Masiphathisane and is anchored on our strategic focus of containing virus, investing in sustainable solutions, protecting the vulnerable and the poor, and rejuvenating the provincial economy and securing the future. Sithi namhlanje sizisa enye indlela yokulwisana nale ntsholongwane apho sifuna wonke umuntu athathe inxaxheba, apho sisithi indlela yokulwa nale ntsholongwane ngokuyimpumelelo sifuna lento kuthiwa ngu-bottom up approach. Abantu mabayeke ulindela ukuba kuthiwe mabenze lento, abantu mabebe inxalenye phaa ekuhlaleni yokunqandana, yokukhuselana, njengoba sisitsho sisithi usisiqu khusela wena khona ukuze ukhusele ifemeli yakho. Xa ifemeli yakho ikhuselekile, ukuhlala kwabantu kukhuselekile, and xa abantu bekhuselekile ekuhlaleni, ilizwe lakuthi likhuselekile kwaye ilizwe lakuthi lakuba nekamva eliqaqambileyo. Siyinqande imeko yokusulelana kwabantu nokubhubha kwabantu ngendlela esiyibona ngayo. Ngokwangoku alikabikho ichiza lokunyanga le ntsholongwane. Indlela yokunyanga le ntsholongwane inye kukuba abantu bahloniphe imiqathango emiselweyo by World Health Organization, by our National Command Council. Sonke silandela elo khondo. Uba silandela elo khondo, sihlala ezindlini, sihlamba izandla zethu rhoqo, sinxiba iimask sawube siphumile, sigcina umtyhi ngokubhekelelana apho sihleli khona nabantu, abantu bakuthi bazawungakwazi ukosulelana nale ntsholongwane. So siyafuna ke le ntsholongwane into kokuba ngoku ingabi lixanduva lamajoni namapolisa nabagcini bocwangco nabagcini bomthetho, ibe luxanduva lwethu sonke thina abantu abakhoyo apha njengoko umongameli ebenze njalo ukwenza umemelela ilizwe lakuthi balenze loo nto. With it, we are taking the fight against COVID-19 to the wards with a high number of COVID-19 cases, where we will bring on board all stakeholders in the form of Ward Command Council to work together to manage the spread of the virus. Kweza Ward Command Council kulapho sifuna uqinisekisa uba bonke onomakhaya, onompilo, ukhansila, ward committees, CDWs, bonke abantu abasekuhlaleni, inkosi necawe, siyakwazi ukusondelelana sisebenze kula ward command council, sikwazi ukuncedisana nokwenza umsebenzi lula nakwezi tracing teams zethu, kuba ithatha intsuku ngelinye ixesha abantu babayazi babekho kumngcwabo endaweni ethile, siyothuke sele kophulwe sele isasazeke ngakumbi, kanti bangaba siyenza sisekuhlaleni yonke into siyayazi apha ekuhlaleni uba ikhona into eyenzekayo, ikhona into engaqondakaliyo, ikhona into engaqhelekanga phaya. Sikwazi ukunxibelelana ngokukhawuleza, sisebenzise onke lamaqumrhu nezi-arhente zikarhulumente ukulwa nale ntsholongwane. In this regard, we have identified so far about 87 wards. As 87 wards zilapha kwi-metros, Nelson Mandela Bay neBuffalo City. But sine-wards eziqhubekayo phaya kule cluster sinazo zintsha yase-OR Tambo nangapha. But our team is consolidating that. These 2 metros are the ones that are really epicenters that are accounting for bigger numbers of COVID-19 infections in our province. So sizama ukugxila sijonge pha because sijonga amacebo okuqinisekisa into kokuba zeziphi ezinye indlela esinoyinqanda ngayo le ndlela nalo mcimbi wokurevisa ii-lockdowns sijonge into yoba ezi intermittent kind of approach ze-lockdowns azinawusisebenzelana kwezinye indawo apho sikwazi ukuthi kule indawo masinqande, masivale kule indawo, sincedisane ukuqinisekisa into kokuba silwa ne-outbreak, silwa nentsholongwane, sikwazi ukucima umlilo. Sesikwazile uyenza loo nto as Lalin, where we started this fight against this. Our objectives as the province through this community-based response plan is to increase number of recoveries, decrease number of active patients, and decrease the rate of the spread of the virus. To achieve this, we have 7 key steps that will help us contain the virus, and these are mapping for response planning, community entry and containment, implementation, bed provisioning and field hospitals that we are working on, monitoring, active surveillance, that is data management and feedback, redeployment, disengagement, that is no active cases, community ownership, functional structures. Looking at the number of people in self-isolation in our province, we have taken a decision that in order to avoid the risk associated with inappropriate and dangerous behavior by some of the people self-isolating in their homes, more positive cases should be isolated under supervision for us to reduce local spread and avoid a rapid increase in the positive caseload. We have also taken a decision to convert 18 state-owned facilities like museums, schools, hostels, nursing colleges, training centers in all the districts and metropolitan municipal areas of our province into field hospitals to give us additional 2,080 beds, which include 280 high care beds. We plan to have these field hospitals ready soon as that we are able to accommodate more people that will need hospitalization and isolation. The community-based COVID-19 response plan will also help us to address issues of criminality in our province, which were reported and are investigated by the South African Police Services, which include 121 cases of burglary at schools, increasing number of violence, such as 338 cases of rape, 267 cases of murder, 82 cases of culpable homicide. The South African Police Service is also investigating 158 cases of attempted murder, 1,331 cases of assault, 116 cases of drunk driving, 50 cases of driving under the influence of liquor, where accident occurred, and 66 cases of driving under influence of liquor, where no accident occurred. The province continues to work with the private sector to assist business to access the grants provided by the national government for them to recover from the economic hardships caused by this virus. We appreciate the contribution being made by the businesses in the fight against this virus, because the contribution they make is to the benefit of our people in our province. I must add that we are receiving disturbing complaints from workers that some businesses are not complying with occupational health and safety protocols. This is unacceptable because lockdown regulations were relaxed so that we can balance the impact of this virus with the preservation of our people's livelihood. Unions and shop stewards must be vigilant and ensure that the safety of their members is prioritized during this pandemic. This is a matter we will be attending to vigorously with the Department of Labor, as it has potential to spread the virus from homes to business premises and from business premises to homes. All stakeholders must continue to act responsible during this period. As we reported last time, we are working with our schools to make them compliant with occupational health and safety requirements in place for this COVID-19 outbreak. We are doing this to ensure that learners, teachers, and support staff in our schools are safe at all material times. The rate of infections in the schools after we phased in the 2 grades showed us that schools have a potential of becoming cluster outbreaks, that it was not safe to allow younger learners back to school during this winter period in our province. We have since engaged the national government requesting permission for a risk-adjusted approach or the differentiated approach as we allow more grades to come into the schooling reopening. We are allowing our grades to continue coming in right through August, from the mid-August onwards, but we want our grade Rs to only come back in August. It's very clear, and we know that that's a very high risk in the situation of Eastern Cape, where we have got these young grandchildren staying with their grandparents. And if these young people are contracting this virus at school, it will be more dangerous for their grandparents back at home, especially in the rural areas. Let me close, ladies and gentlemen, with these two matters of critical importance. The first one is the alleged corruption that has raised its ugly head again in one of our municipalities, the OR Tambo district municipalities, in the form of a very suspicious so-called door-to-door campaign which cost 4.8 million. We were not surprised at all when it happened, because we knew there will be chance takers who would use this pandemic to get rich quick. Hence, from the onset, our Provincial Command Council meeting directed all accounting officers, municipal managers to be on high alert during this time and pay particular attention to procurement-related matters. We want to lead this fight free of scandals. We want scandalous-free campaign against this virus. Where issues like these show their ugly head, they must be attended to. I've already written as well to the President asking for SIU. The MEC, COGTA, and the Department of COGTA with Treasury are already working on a preliminary investigations on the allegations that have surfaced, issues against alleged fiscal dumping, payment of money to service providers that have not done any work. All that packaged together must be attended to. So we are dealing with that situation in OR Tambo, but our attitude and our approach is that we must always seek the truth from facts.